Hey there, Dr. Krista Burns from the American Posture Institute. Dr. Wade's joined me as well. How's everybody doing today? Thanks so much for joining us for the webinar. It's always so much fun to connect. Today we are talking about neurology of the posture system, and we're going to have a lot of fun doing it too. Now, don't worry, some people get kind of overwhelmed when I say the word neurology. So what we're going to do is we're just going to break it down. We're going to go through a webinar. It'll be, an opportunity to learn a little bit more about the neurology of the posture system, but also to expand your mind of exactly what's going on, what's going on above the cervicals to control our postural design. So as you guys are logging on, you know how it goes. You know the drill. We always like to see where our audience is from. So let us know who you are, where you're from. Let us know if you're a CPE, which is a certified posture expert. And let us know what you're up to. Are you guys home? Are you in your clinic? What are you doing today when you're watching this webinar? I know personally we just finished up with patients at the American Posture Institute. Jam-packed day, super fun, lots going on. Couple podcast interviews today, a webinar, jam-packed full of patients. Not to mention this opportunity to connect with you guys today. So thanks so much for joining us again, and let us know who you are, where you're from. Let us know if you're a CPE and what you're up to today. So kind of a cool story from today in practice. I just did a reeval with a patient, and I always love reevaluations. If you guys are anything like me, it's that opportunity to kind of reconnect with the patient. Yes, you see them every time they come in, but the reevaluation is kind of that moment to sit down and have more of a conversation and learn a little bit more about them, what's going on with their case presentation and whatnot. So we have a girl named Deborah who started care, 4 weeks ago, approximately, and she's been getting really good results. And she says, I need to talk to you today. And I said, okay, wondering what was going on. And what she wanted to talk to me about was flying her mom up from Sicily, which is in the southern part of Italy, to start doing care in our clinic. So I thought that was pretty cool. She's getting such good results that she wants to start flying her mom in once a week to actually do care in our office as well. So that was a nice compliment. That literally just happened about an hour ago before hopping on the webinar. So I thought that I would share that with you guys today. So again, as you're logging on, just let us know who you are, where you're from, what you're up to today. And of course, give us a shout out on social media, letting everybody know that you're joining the American Posture Institute for a free webinar regarding the neurology of the posture system. Now, as always, we're going to do live Q&A at the end. So if you guys have any questions, which I suspect you might, because we haven't really gone over this information before. So if you have any questions at the end, just save them for me. I'm going to go through all of them. I'm more than happy to provide value to you and answer your questions, meet you where you're at with your understanding of the neurology of the posture system, so we can work it out together. And of course, I like to keep everything clinical and implementable, so we're going to have some practical application tips as well. Now, here's the deal. If you do these clinical application tips, be sure to give us a shout out on social media and let us know how it goes with your patient. Sound like a deal? All right. Well, we're going to get started in just a minute here. Again, as you're logging on, let us know who you are, where you're from, what you're up to. And you can always head over to the American Posture Institute Facebook page and give us a like on Facebook. Doing that just ensures that you're going to get notifications when our blogs go out, Facebook Lives, when we have announcements like webinars, which we do pretty much monthly, all kinds of stuff. We like to jam-pack social media with tips, tools, and resources for posture experts so that you can reach your community as a posture expert, educate them on the importance of posture, and just be sharing information on social media. Because we know what it's like when you're a busy practitioner, you need to focus on results and being with your patients. So you can easily just share our information, makes your life easier, and then your community is still getting posture information. So give us a like if you haven't done so already. And we're going to hop into the information in just a second. But before we do, just a quick shout out. Dr. Mark and I are actually headed to the United States tomorrow. So if any of you are going to be joining us at any of the following conferences, just to give you a heads up of where we'll be, this weekend we're speaking at Cleveland, Kansas City Homecoming. So we'll be in Kansas City. Then we're heading straight over to Atlanta to speak at Life Vision. And then from Life Vision, heading up to Michigan for an EPOC event. And then from there, going over to Scottsdale, Arizona for the League of Chiropractic Women. And then from Scottsdale up to Portland, Oregon. And we're going to be speaking at ChiroFest. So if you guys are going to be present at any of those seminars, be sure to give us a shout out. Stop us and say you were on the webinar. Stop us and say hi if you're a CPE. All right, we got Howard on the line from Stamford, Connecticut. Hi, Howard. Thanks for joining us. It's always a pleasure to have you on the line. We appreciate you participating. We got Mario connecting from sunny southern España. not too far from us over here in Italy right now. Very cool. Thanks for joining in, Mario. All right, guys, we're going to get started on the information for tonight. Again, if you guys have questions, be sure to save them for the end. I'm more than happy to answer any questions that you have. All right, guys, give me 1 second. Let me pull open the PowerPoint, and then we will get to just a second here. Okay, so it looks like you guys can see that, which is good. It's always nice to have a visual when doing a presentation. Okay, so by joining me today on the webinar, you're going to understand the posture paradigm and how important postural correction is to the health and the function of human society. So you'll have a good understanding of the neurology of the posture system to make the structure-function connection. Then you will understand the physiologic compromise of postural distortion patterns and how improper posture affects human design and function. Plus, you will learn brain-based analysis and correction strategies for sustained postural control. By retraining the patient's postural physiology with a brain-based approach, you can make predictable, lasting postural changes that will transform your patients. The information in this presentation, when implemented, will help you get better clinical correction results with your patients and have more resources to add to your clinical tool belt. Let's begin by answering this important question first. So, what is posture? Posture is the framework of human design while upright, static, and moving. It is controlled by your neurologic system to perform every movement in static stabilization. Your postural design is controlled primarily by your brainstem. Postural balance is the ability to maintain the body in an upright position against gravity, dictated primarily by the vestibular system for balance. Postural fitness is the ability to maintain resilient, static, and dynamic posture during your activities of daily living. This aspect of posture is controlled primarily by your motor cortex. A patient to the environment in which they live. So human beings are self-healing organisms that can adapt and overcome stressors in the environment. An aligned spine is an open channel for sensory and motor neurons to communicate with the brain. This is called sensory-motor integration and is so important to precise motor function and designed output. Proper spinal alignment allows all of the body's systems, such as the respiratory, circulatory, digestive, and nervous systems, to function at their highest levels. An aligned body is a balanced body. Balanced bodies are in homeostasis within their environments, and homeostasis is orderliness among bodily systems to prevent bodily disorders. When posture begins to weaken, however, the opposite also occurs. So not only do you have a weak posture, but you also have weaker output from your brain, causing an effect on your overall function. So instead of having a nice S-shaped spinal presentation with the shoulders and head back and pelvis neutral, the patient goes into what's called a flexor-dominant posture. Our primary job as posture professionals is to bring the patient from anterior flexor-dominant posture to upright extended postural design. And we will give you some brain-based tips of how to do exactly that today. So flexor-dominant posture is a weak postural presentation interfering with the patient's ability to function optimally. And yet, ironically, all of our habits promote flexor dominance. So whether your patients are sitting at a desk or driving in a car looking down at their phone, your patients are flexor dominant all day, every day. Now, one of the primary roles of the nervous system is to inhibit flexion. Flexion of the posture system is absolutely a neurologic lesion. It is a de-evolved position of human design and lesser intelligence. Here's the worst part. De-evolved posture is a demonstration of a brain deficit. Have you ever seen a patient after a stroke? They have flexor-dominant posture. Or how about a Parkinson's patient? They too have flexor-dominant posture with a shuffling gait pattern. Weak posture is a visual indication of decreased brain output. The brain craves complexity. To build neuroplastic changes in the posture system, it requires dynamic movements and novel stimuli. Our bodies are designed to move with upright extended posture or anti-gravity posture. However, what do most of us realistically look like? Yeah, we look like this. Maybe even some of you guys watching the webinar right now, right? This is how our habits have designed us to be. Our brain craves movement and complexity, but we do this all day instead. Society is primarily flexor dominant due to a sedentary lifestyle. While sitting, your extensor muscles are inactive and you're engaging your flexor muscles. Did you know that Americans spend on average 13 hours per day sitting and up to 8 hours per night sleeping? That's 21 hours of inactivity each day, 21 hours of flexor dominant posture. The effects that this has on our body is not just musculoskeletal. A new medical diagnosis called digital dementia shows that extended technology use in flexor dominant posture is weakening brain function, causing memory loss, depression, developmental disorders, and even anxiety. This is a serious problem that our society is facing and will continue to face in future generations if we don't commit to the necessary paradigm shift. Patients need to be doing brain-based postural correction to heed off signs and symptoms of brain deficits such as digital dementia due to postural decline. The paradigm shift starts with you. If not, their health will weaken and movement will become more and more difficult and painful, which means that the patient will avoid movement. And of course, we know that the brain requires complex and novel stimuli. So let's talk a little bit more about the posture system so that we can dig deeper into physiologic compromise of weak posture. Now, the posture system is a highly complex system that's broken down into 4 posture quadrants. By evaluating the structure and function of each posture quadrant, you'll have a clear understanding of the health integrity of the posture system. Posture quadrant 1 includes the head and the cervical spine. The head is utilized for orientation and the cervical spine for stability and protection of the brainstem. Posture quadrant 2 extends from the shoulder joint complex anteriorly to the base of the rib cage. Posteriorly, it extends from the 1st to the 12th thoracic vertebrae. The orienting anatomy of posture quadrant 2 is the hands, and the stabilizing anatomy is the shoulders, the scapula, the rib cage, and the thoracic spine. The primary functions of the second quadrant are to mobilize the upper extremity, to perform respiration, and of course for circulation. Now, posture quadrant 3 extends from the top of the diaphragm to the femoral head of each leg anteriorly. Posteriorly, it extends from the first lumbar vertebra to the base of the ischiotuberosities bilaterally. So posture quadrant 3 is the only quadrant that is primarily stabilizing. It is the principal stability quadrant from which you stabilize your internal environment. It's also referred to as the core posture quadrant. Now, posture quadrant 4 extends from the femoral head of each leg to the distal phalanges of each foot. The orienting anatomy of posture quadrant 4 is the feet, and the stabilizing anatomy is the leg, the lower leg, the knee, and the ankle, with the primary function of performing coordinated gait patterns and ambulatory movements. Now, let's evaluate higher order postural control. The basis of the neurologic system and posture is this. The body receives input or afferent information from the world in which we live. Afferent information arrives primarily from the visual, the vestibular, and the somatosensory organs. This input is interpreted by the contralateral cortex, which initiates a motor response. The cerebellum refines that motor output, and when the frontal cortex initiates a motor response, 80 to 90% of the fibers initiate the movement on the opposite side of the body. However, there are 10 to 20% of the fibers that stabilize the body ipsilaterally, meaning that to perform a coordinated and appropriate movement on the left side of the body, the right side of the body should be stabilized, or the patient would what? Yeah, they would lose balance and they could fall over. The stabilization mechanism is of utmost importance for our purposes. Lack of stabilization or lack of inhibition of movement means that the body's posture is jerky, uncoordinated, and of course flexor dominant, which we want to avoid. So how do the neurologic pathways work together to ensure that the posture system is upright and able to maintain upright posture during coordinated movements? The main systems that work together for postural stability include the visual system, the vestibular system, and the somatosensory system. The visual system contributes to postural control by delivering information from the retina to different areas in the brain that allow for object identification and movement control. Patients who present with visual impairments may have an impaired ability to control their posture and their balance, especially during movement. Why? Because as human beings, we keep our bodies vertical to the ground and eyes parallel to the horizon. So I want you guys to check out this picture here. In the brainstem, we have what's called the medial longitudinal fasciculus. Do you guys remember learning about the MLF or the medial longitudinal fasciculus in school? So the MLF is a complex fiber bundle in the brainstem made of fiber from the vestibular fibers, from visual motor fibers that control eye movements, and from descending fibers of the tectospinal tract. The tectospinal tract is the pathway that controls movement of the neck to coordinate head and eye movements. So what does all this mean? Therefore, when there's dysfunction of the visual or the vestibular system, it directly impacts the postural presentation of postural quadrant 1, which is the head and neck. So by stimulating the eyes and the ears, or more specifically the vestibular system, you will often see immediate changes to head posture. These are the patients who present with chronic head tilt or who still have neck tightness even after their posture has improved. So now what about the rest of the patient's posture? Quadrants 2 through 4. We just covered posture quadrant 1. So to understand how this anatomy is impacted by higher order function, let's take a look at the vestibular system. The vestibular system, which consists of organs located in the inner ear, contributes to postural control by interpreting changes in movement and direction and velocity of the speed of movements. This information is sent to the pontomedullary reticular formation of the brainstem, which then stimulates a response that allows your postural muscles to activate and increases your bodily awareness. When this system is compromised, we see patients that present with vertigo and balance issues. So the vestibular system is of utmost importance because it activates your extensor response. We just discussed that flexor dominant posture is weak postural design. So when the vestibular system is compromised, you're going to see anterior flexion above the T6 spinal level, like that picture there. And now I know I'm not the only person seeing posture like that in practice. We get it all the time on a daily basis at the American Posture Institute. So these patients are your postural hyperkyphosis patients with anterior rolling of the shoulders and chest flexion. So if you've been doing work with these patients for a while and they're not responding from exercise and adjustments alone, consider the importance of brain-based treatment protocols, which you will learn in just a few minutes. So let's look first at how to determine visual and vestibular weakness so we know we are being accurate with our treatment plan. First, we'll evaluate eye movements. Now, the movement of the eyes is vitally important to us because the nuclei of the cranial nerves that control eye movements synapse in the same group of descending pathways that also control neck posture. So when you guys think of eyes, think of the cervical spine, or when you think of cervical spine correction, I want you to also simultaneously think about that visual system. Now, you guys learned this in school, but let's do a quick refresher. So to check eye movements, you want to see all cardinal fields of gaze. So have the patient follow your finger as you move it throughout each field of gaze. Evaluate these movements. Study the eyes of the patient. Do they easily follow your finger or pen, or do they fatigue? Watch for changes in posture with weak eye muscles. They'll compensate with their neck muscles specifically, and also watch for nystagmus or isocods. So you're going to prompt the patient not to move their neck, not to move their head, but just to follow your finger or follow a pen, with their eyes. And if you start seeing any changes in their bodily positioning or their bodily posture, they might start compensating or fidgeting. Those are going to be indications that you need to look further at which eye, specifically which cranial nerve controlling the eye movements, is going to be weakened. So a saccade is a quick movement of the eyes back to midline because they cannot keep their gaze fixated on the range of motion that you're testing. Now I want you guys to take note of what you see when you test the fields of gaze. Then let's also test what's called eye convergence. Now convergence is your patient's ability to converge or draw their eyes medially while focusing on a point, in this case your pen or a finger. So we can determine their ability to converge their eyes based on the convergence test. So I want you guys to hold your pen at about a 45-degree angle away from the patient, about 14 inches or so. You bring your pen midline in the center of the eyes. Ask the patient to focus on the pen. Watch them converge their eyes. Are they able to bring both eyes to midline? That's what you're specifically watching for. Very commonly, what you're going to see is a divergent eye, meaning that one eye converges medially and the divergent eye diverges laterally. The divergent eye is considered the weak eye in terms of convergence. So just to repeat that, convergence means that it goes to the center, and you can see the arrow here that's pointing to the divergent eye, meaning that the eye did not go midline, or maybe it went midline, but the patient wasn't able to hold that position, so the eye diverged laterally. That's considered the divergent eye, or as we just mentioned, the weak eye. So from this eye screen, take note of visual field of gaze where the patient fatigued in the first test, and note the divergent eye in the second test. We just collected essential information for our brain-based posture assessment. Now let's do what's called the Fukuda step test to localize vestibular weakness. For the Fukuda test, you will have the patient stand in normal posture with their arms out in front, ask them to close their eyes and march in place. So you guys have seen this done before. They're going to march, but here's one of the main things that people do is they only have the patient take a couple of steps in place. You want them to march at a rapid but controlled pace for about 50 steps or so. So before starting the test, you want to have a marker on the floor or have them start in front of a posture grid. When they open their eyes, compare the stopping position to where they started. The patient will march to the side of their vestibular weakness. So for example, if they march left, they have a left vestibular deficit. So again, just to review that, with the Fukuda test, you're going to have the patient close their eyes, put their hands out, and march in place. And as they march in place, they're going to sway to one side if they have a vestibular weakness or dysfunction. When they open their eyes, you want to point out to the patient that they have made a change. Anything that the patient can see and feel is going to help them understand better their case presentation. So does this all make sense? Are you guys following me okay? And again, if you have any questions at the end, be sure to let me know and we'll go through those, okay? So now that we have this information that we just collected, what are we going to do with it? At this point, you're wondering, how is this going to help my patients? So first, let's talk about eye movements. The patient can do gross eye movements and specific eye movements that will really impact their posture. So the first thing, they will begin by doing large eye circles following their own finger. After doing a few large circles, they're then going to focus on their specific cardinal view of gaze where there was a weakness. So for example, if they demonstrated eye movement weakness of up to the right, for example, have them do pursuit eye movements up and to the right to strengthen that movement. So that's just going to be the patient is going to pursuit, which they're going to look up and to the right where the weakness was. And then they're going to hold for about 5 seconds minimum, and then saccade back to midline and keep repeating that exercise. So this is a seemingly easy task, but when a patient is compromised, it's going to be difficult for them, but it's a good thing because it's going to be challenging their nervous system, because we need to make changes in the eyes in order to have better head posture and overall better postural design. So have them do that, have them do it multiple times until they get to the point of fatiguing. Then to work on convergence, do small eye circles where the eyes are converged to follow the motion of their finger. So they perform small eye circles for 30 seconds initially, and then they're going to work up to about a minute or so. Now, after performing these tests, you can do an immediate retest. So retest their neck range of motion, and it should be increased after doing this. Also recheck their eye range of motion. They will instantly have better convergence and ability to view all fields of gaze. So I just want to go back for a quick second when I was talking about the small eye circles here. When there's a divergent eye, so in the example we saw, I believe that the right eye was divergent. So if the right eye is not going midline, what you want to do is you want to take your pen and you want to move it over in front of the opposite eye. So if the right eye does not go in, move your pen over in front of the left eye and do small eye circles there, because when the pen is past midline, it's creating more of a convergence challenge for your weak eye. So it's going to be very beneficial. Okay, and again, retest cervical range of motion pre and post. And of course, retest and make sure that you've made the appropriate changes with the eyes themselves. Okay, plus let's talk about vestibular training. So the vestibular system controls not only your ability to hear and to interpret auditory input, but of course it controls your balance and your equilibrium. So the side that was weak during the Fukuda test will focus on more specifically to build their postural fitness. So you can choose one of the following options, or you can do all of them with different patients. So the first is going to be one leg balance. So have them stand on one leg with proper posture for 30 seconds. Honestly, docs, this is an invaluable exercise that everybody should be doing starting, even your little patients that are coming in the office. So when they can do this, have them advance by closing their eyes. So by eliminating the visual field, it creates more of a stimulus to the vestibular system, and we're reliant upon proprioception and the vestibular system to hold our bodies upright. So it's a really great drill for that vestibular system. Or you can do one leg balance on a wobble board or a Bosu ball. So if you have those in your office, you can get those out for the patients. And when they get started, if they're unable to stabilize at the beginning, just have them put their hand against the wall and slightly tap the wall back and forth, where they eventually develop the postural fitness to take their hand off the wall. But by having that unstable surface, again, it creates more challenge to the vestibular system, which provides us the ability to make better neuroplastic changes in the posture system. Or, of course, they can also do one leg balance on whole body vibration. Vibration is an incredible and highly underutilized stimulus for the vestibular system. Now, if you don't have whole body vibration in your office, you can also get a handheld vibration tool and apply vibration to the weak side, so specifically to the hands and the feet on that side. Now, another really powerful tool that you can use to stimulate the vestibular system that's absolutely free is gaze fixation with head movements. So have the patient fixate their gaze centrally on their finger and move the head back and forth. This is what's called a no-no exercise, because they're moving their head back and forth in the horizontal plane as if nodding their head no. So of course, after this, we're going to retest by doing the step test again, and they should be able to march in place or at least have less movement as they march. Let's go back here for a quick second regarding the no-no exercises. So again, I just want to re-explain to make sure you guys got that so you can implement it with your patients. So you're going to have them hold the pen in front of them, and you can see from this picture here that my eyes are stabilized, they're looking at the pen, but my head is turned to the side. So what we're going to do is go back and forth as if, nodding your head no, but keeping your eyes fixated centrally on that pen. That's going to be a really good stimulation exercise for those horizontal semicircular canals that help control balance. So you can do that a minimum of 5 times. In addition to that, you can keep doing more, and you can add this exercise with other exercises that you're doing. You can see, for example, that I'm standing on a vibe plate in this picture, which means that it's just more of a stimulus to that vestibular system. Okay, always retest post-treatment. Make sure that the stimulus that we've been putting into the system is creating those neuroplastic changes that we want. Okay, that was a lot of information. So you're probably wondering how you can work this in with your current patients. You can simply add these eye and these vestibular assessments to your initial clinical examination. At our office, we do these exams on the first visit as well as the reevaluations. Now, regarding correction, at the American Posture Institute, we have a 3-component system of postural correction, which includes spinal alignment, posture rehabilitation, and of course, posture habit reeducation. So we start each visit with our spinal alignment treatment protocol called the complete postural correction. Now, after getting their adjustment, the patient then does their posture rehabilitation exercises. So they do rehab on their own. Also, they have one exercise appointment to learn how to do everything and ensure that they can do all of the exercises with proper posture. Now, we integrated musculoskeletal rehab with brain-based movements and functional protocols so the patient can get the most benefit possible. Implementation is not something that's overwhelming. In fact, it's really easy to do. And the best part, all of our postural correction systems at the American Posture Institute require little amounts of equipment. So we pride ourselves on providing our doctors with strategies that work and can be implemented in any practice throughout the world, regardless of size, adjusting technique, regardless of the amount of staff members that you have. And that is really important because, in addition, if you don't have a lot of space in your office and you don't want to do rehabilitation in your office, that's totally cool. There's no worries there. All you need to do is instruct the patients of how to do and what to do, and they can do that at home as their homework in between the adjustments that they're doing in your office. So you can really activate the brain while they're here in your office, but in addition to that, give them homework. They should be doing these things every single day. So give them eye movements to do at home. Give them VO VORs, which is the vestibular ocular reflex. Give them those no-no exercises. Have them doing one-leg balance. Have them telling their kids to do one-leg balance. When they do it as a family, of course, we know that the retention is going to be even better. So it's really important to think of these things when it comes to implementation. Now, one more takeaway to implement with your patients before we wrap up. Now, there's one more posture rehabilitation exercise that you can have your patients at home, do at home or in the office. That's going to be a really high beneficial one to add to your postural correction protocols. So all of the patients at the American Posture Institute are doing this exercise from day one of their treatment plans. This exercise is called wall posture with neck retractions. So the purpose of this exercise is to keep the patient's trunk against the wall while moving their pelvis to correct pelvic tilt, and while retracting the cervical spine to improve neck posture. Okay, this is a fundamental exercise. Now the patient begins against the wall with their feet a step away from the wall. By keeping their shoulders, arms, and back against the wall, the patient then tucks and arches their pelvis. They simultaneously move their head forward and then retract it back against the wall. So from a musculoskeletal approach, we have seen these exercises done before by a lot of chiropractors, which is great because they work really well. What a lot of people don't realize about doing neck retractions is that it is far more than just a musculoskeletal exercise. In fact, you're also engaging in an important reflex called the vestibular reflex. Now, the vestibular reflex is the reflex mechanism connecting the cervical spine and the vestibular system, which activates extensor tone. So we know that our goal with postural correction is to inhibit flexion. Well, if this exercise helps with alignment by reversing the postural distortion pattern of forward head posture, plus it activates an extensor response, meaning that this exercise is an exercise that your patients cannot afford to not do. So it's easily implementable. Patients can do this every day at home or in your office after getting their treatment protocols. They can start with a set of 5, and as they build more postural fitness, they can work up to doing 3 sets of 7 of the exercise. Okay, so did you guys see how easily you can implement neurology into your practice to improve postural correction results? Now, I know I really want you to appreciate the bigness of what you do and recognize the impact that you can make on your patients' lives. Knowing what you know now, it is clear that the future of our society needs more posture experts and postural neurologists. The impact of the posture paradigm is going to be huge, and quite honestly, the health of our society completely depends upon it. Our belief at the American Posture Institute is that with more certified posture experts and certified postural neurologists across the globe, we can shift the direction of healthcare to improve postural design and optimize human function. Posture is definitely the answer. And the best part, patients get posture. Posture is in their belief system. All right, docs, the information that you learned in the webinar today is only as valuable as the implementation in your office with your patients. So this is your opportunity to connect with your patients at a higher level, to get better clinical results, and to develop your expertise as a postural professional. Now, for those of you who are interested, I have also prepared a research guide entitled The 20 Research Studies That Every Brain-Based Posture Expert Needs to Know. So you can get this guide for completely free by visiting the following link, which is americanpostureinstitute.com/neuroresearch. Now, why did I put together this free guide? Quite simply, I put together the free guide because I know that I love research and I love neurology, but I know that you guys are so busy in practice and you don't have a ton of time to sit around looking up all these different research studies. So the good news is I took the top 20 and I put it together in a research guide that you could just have as a manual in your office. So you can download it for free. It's broken down. It gives you the citations, but in addition to that, a summary of the article. So you don't even have to read the whole article. I know you guys will find it super beneficial because you guys are really busy. Now, again, with implementation, success awaits you. So it's been a huge pleasure to join you on the webinar tonight. Another big thank you to everybody who's been here. And I want you guys to remember that it's posture by design, not by circumstance. Okay, so now let's be sure to answer any questions that you guys have before logging off. So let's see here. If you guys have any questions, I can see a bunch of you logged on while I was talking there. That's excellent. So what I was just saying about the neurology of the posture system, again, is it's a very complex system, but it recognize the complexity and appreciate the complexity, but also recognize the fact that you have an ability to tap into that system by doing postural correction care. So you don't need to be super overwhelmed by all of the neurology. Recognize what's important about the neurologic system and how you can utilize that every single day with your patients by doing small changes such as eye movements and one leg balance that has an astounding effect on their overall postural design and the neurology controlling that posture system. All right, MC says pelvic tilt equals sacral nutation or counter nutation. So when doing pelvic tilt, are you referring to the exercise that I was showing against the wall? So what you're going to do is you're going to have your patient stand about a foot length away from the wall, and they're going to have everything. What we're trying to do is activate extension, basically. So their palms of their hands are going to be, sorry, not the palms, the back of their hands are going to be against the wall. Their shoulders are against the wall, their head's against the wall, their back's all the way against the wall. The only thing forward is going to be their feet. They're going to keep their legs straight, and they're going to create pelvic arch and then a pelvic tuck forward. So it's going to go, if this is the pelvis, it goes here and then down and forward. That's going to be the position. Okay, so it's going to go here, down and forward. And then it's going to be a rotation anteriorly of the pelvis. And what we want to do is anterior and posterior pelvic tilt. So anterior tilt is and pelvic tilt to have that hyperlordosis, but then to correct it and have a nice straight spine. Now, as you're doing that, you're also going to do the neck retractions. So the neck's going to go forward and back, forward and back. And just because if you guys haven't done this exercise in practice, all patients that make this mistake the first time, they go up with their head like this instead of going straight forward and straight back. And when we're going straight forward and straight back, it's actually a signal to the otoliths to start stimulating more extension. So by pushing against the wall posteriorly and by doing that forward and posterior, anterior-posterior glide of the cervical spine, it's a really good stimulus stimulating that vestibular system. So that's going to be an exercise that you guys can literally implement right away. Super easy, really great effects from a musculoskeletal perspective, but also from a neurologic perspective. It's going to be a really nice complex movement for the midline of the body that's going to stimulate extension bilaterally because you're moving both sides, so it's going to be bilaterally. All right, you guys have any other questions? So let's just say one more time how important it is specifically for head posture to consider the position of the eyes. So if we think about this, if I was talking about convergence before, so convergence is your eyes going midline. So going midline like this as if I was looking at my nose, okay, from here to here. Now, if one of the eyes is divergent, then it's not going to go midline, it's going to go to the side. So if you have a divergent eye, let me just grab a pen so I can show you guys. I had talked about doing small eye circles. So small eye circles are going to be just like this, where the patient's going to follow the pen with their eyes. Now, as they do that, they're stimulating their eyes to build more convergence. So if this eye does not converge midline, it does not go center, then what I want to do is I want to do my small eye circles over here in front of this eye, because as I'm doing those small eye circles, it's creating convergence with this eye. So it's a really beneficial complex movement that they can do that's going to be really great for their brain, as well as really good for that visual system, which we need to have in proper alignment in order to have better cervical posture. All right, John says you covered a lot of info. Is this webinar being recorded or transcribed, and are we able to see it again? To be honest, I actually have no idea, John. I apologize. I don't know how to answer that. But yeah, you'll get an email with access to the replay. Thanks, Dr. Mark. He's the one who handles the back end there. In addition to that, John, if you want to take advantage of the free gift, AmericanPostureInstitute.com/neuroresearch. That's going to be really beneficial too, because it just gives you 20 brain-based research studies that are good to have as a reference. It just is more validation of what you do, how it works, why it works, and the importance of the eyes, the spine, and the vestibular system in terms of higher order control of the postural system. So again, by activating the neurology that controls postural design, we can make more profound neuroplastic changes of the postural system. Mario says, Dr. Burns, you're a gifted communicator. Thanks so much for sharing. Mario, thank you. I really appreciate you saying that, and I appreciate you being on the webinar with us today. I hope you're enjoying Spain. Yeah, so let's talk a little bit more about why did I choose visual and vestibular system for this webinar. So I mentioned that the brain stem is particularly controlling your posture. So the brain stem is going to be right here, obviously. You can't see exactly what I'm pointing at, but the brain stem is going to be your main control of your posture. And the cranial nerve nuclei for cranial nerves 3, 4, and 6, and cranial nerve 8, which are all the cranial nerves that move your eyes, and the cranial nerves for auditory input as well as vestibular balance, they all live within that brain stem. So if the brain stem controls postural design and those cranial nerve nuclei are sensory nuclei within that brain stem, then doing movements that stimulate those cranial nerve nuclei to be more active are going to have an effect on the brain stem that's going to be highly beneficial for their upright postural design. So Howard says, appreciate the specific eye protocols for diagnosing and treating cardinal fields of gaze deficits. Did the neuro program and this give some easy concrete treatments? Absolutely. Yeah, and that's just it. These are super easy things that you can implement without needing to buy any equipment. All you need is a pen, or you can use your finger. And it's just going to help you get better correction results with your patients, knowing how important the visual and the vestibular system is for postural correction. Because again, if you have patients who they've been coming in for a long time, for example, and they're actually following your recommendations, right? Like you can see visual changes musculoskeletally on their posture images pre and post. They look better. And in your mind, you're confused why they're still not moving the way that they should be moving. So maybe they still have neck stiffness on rotation or lateral head flexion after, let's say, a couple of weeks of care, even though they've shown visual improvements of their posture. Definitely with these patients, really take a look at the visual system, because if they aren't able to converge their eyes, if they're not able to move their eyes in all cardinal fields of gaze, if they cannot saccade, if they can't do smooth pursuits, this is dramatically going to affect their cervical head posture. And so by activating that system, you're going to see instant pre and post changes with cervical range of motion, which is also good from a business standpoint. When you can show the patient pre and post changes instantly, we all know that helps the patient understand more precisely what they're presenting with and how they can improve. So that's the difference of me just telling the patient something versus them seeing it, feeling it, and understanding it. So that's going to be highly beneficial. MC says, thanks, Doc. So combine the forward head translation with the sacral counter nutation, and the cephalic retraction sacral nutation is what I understood. Yes, exactly. So the pelvis goes down and forward. Simultaneously, the head goes forward and back, forward and back. Okay, this is a really good midline stabilization, and it's going to activate extension because as you're doing these movements, again, the head goes forward and back, which is stimulating the otoliths, which are in the inner ear for changes in gravity, position of gravity. In addition, you're stimulating the extensor response by keeping the shoulders, the hands, the arms, the spine against the wall, pressing back into extension. And John says, with a deficiency in the vestibular system that favors one side, should the balancing on one foot exercise be specific to one side or the other? Absolutely. Yeah, John, that's a really good question. So if I do one leg balance as a test and I lean to the right, or if I do Fukuda and I walk to the right, so I close my eyes, step in place, and I walk to the right, definitely stimulate that side. So you're going to walk towards the side of weakness. You're going to fall towards the side of weakness. So you can easily determine that, and you can do that one-sided. In addition, you can, just for overall postural fitness, you can have your patients doing two-sided one-leg balance to stimulate both cortex, to stimulate both sides of the brainstem. But if they do have a very evident distortion, very evident origin of distortion there within the vestibular system, you can definitely do it one-sided. So that's a great question, John. Appreciate it. All right, docs, any other questions before we wrap up this evening? Again, I appreciate you guys being on. It's always the people that show up, that ask questions, that I know are just getting, the best results in practice, because you guys care. You're here, you're putting in the time. And I just wanted to let you know that I appreciate you for it. And again, if you have a chance, go ahead and head on over to our Facebook group at the the Facebook page, American Posture Institute. And if you guys just give us a like on Facebook, what's really cool is that you're going to be more connected to what we're doing at the American Posture Institute, so that you can constantly be getting updates. You can constantly be in the know of what's going on, what's happening within the American Posture Institute. And of course, we always appreciate growing our community for inspired docs like yourselves who are ready to get better results with your patients. Just a reminder, you can also head on over to AmericanPostureInstitute.com/neuroresearch and just pick up that research guide, absolutely free, done for you. Just print it off, or even if you don't want to print it off, just save it so you can refer back to it and have those research studies, which are really going to benefit everything that you're already doing in practice and provide you some more insight into the neurology controlling the posture system. All right, docs, make it a great day. And remember, it's posture by design, not by circumstance. We'll talk soon. We'll be doing another webinar in a few weeks. So if you guys want to tune in, we'd be happy to see you again. All right, make it a great day.